Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. We're recording on January 15th, 2025. Before we begin the show, I want to let you all know that we published a health policy brief this week. The topic is Divisive Concepts Prohibitions, Implications for Health and Health Equity. It's a brief looking into laws and policies prohibiting the discussion of what the first Trump administration in 2020 labeled as divisive concepts and how they hamper efforts to discuss, teach, and use science to understand and improve U.S. population health and health equity. Check that out in the show notes. As a reminder, we also refreshed our Insider program. Insider is our membership program. This year, some of the big things we're adding are different events, as well as adding some new newsletters, including David Simon will discuss the economy. That's in addition to your tried and true Brent Fulton on antitrust and Stacey DeCicina on drug policy, and our very own Laura Tolan and Ryan Tapp writing on health spending and health equity. Check it out. Also in the show notes, if you have more details, it's about $180 a year without a journal subscription. So check it out. Today, I'm talking about price transparency with Leslie Erdelack. Leslie, welcome back.
Hey, Jeff. Good to be here.
Yeah. So is it new year, new you? What's going on?
New year, new me. Yeah. Feeling it.
Awesome. Yeah. Same. New year, new us. January. We're talking, speaking of new things, there are new requirements starting in 2025.
I see what you did there.
Yeah, that's
okay.
A pro transition. There are new requirements starting this year for hospital price transparency. They took effect in the beginning of 2025. Leslie, what are the main talking points to know if you're a hospital on this?
Yeah, if you're a hospital, what you're looking at is the latest round of updates to federal hospital price transparency rules. This is, we've talked about this before. This is part of a years-long push to get hospitals to make what they charge available in a consumer-friendly format. So just to recap, hospitals, at least for the past couple years, have been required to make their pricing public in two ways. They need to post on their websites a file with all their standard charges, and actually you can go to the homepage of your local hospital, and on the bottom, for example, you may or may not find a link to another page where you can get this data in what's called a machine-readable file. So that's number one. Number two, the second thing that hospitals need to do is provide a consumer-friendly list of shoppable services. So these are services that patients can plan for in advance. But new year, new rule. The latest update in 2025 added 3 new requirements. So hospitals now include the estimated allowed amount, which is what they typically get paid by insurers for a specific procedure. Details on drug measurement. So if there's a standard charge for a drug, hospitals are required to tell you the price per unit so you can compare medication costs. And billing modifiers. These are codes that could potentially change the standard charge for a hospital procedure. So this is the final phase of this particular price transparency initiative. And we've seen progress. We've seen persistent challenges around compliance and issues with the data over time. But CMS, the agency that oversees this rule, has invested a lot in trying to make this work.
Yeah, so let's back up. This work, I believe, someone can correct me if I'm wrong, started in earnest in the first Trump administration, if that's correct. And presumably when a rule is made, people just follow it immediately, right?
Yeah, when these requirements were first rolled out. So yeah, it started relatively simply in 2019. Before that, CMS was more or less reminding hospitals of their obligation to comply with this provision. It was part of the Public Health Service Act that required them to list their standard charges. But 2019 is when that regulatory framework really got established. And when those requirements first rolled out, hospitals faced some really fundamental challenges. Hospitals were all trying to report similar information, but they were doing it in completely different ways. A lot of larger hospital systems actually pushed back initially, and they said, hey, we already have our own price estimation tools. Why do we need to do this? So the enforcement and the compliance landscape. So not everybody followed the rules when they came out. So That has sort of evolved since the rules implementation. There were some relatively modest penalties in the beginning. Those increased. Compliance seemed to increase. There were delays in actually issuing those penalties. So all that to say, I think, and then even then, some hospitals remained non-compliant. So I think it's unclear to me how well this enforcement framework is actually working.
Is there anything else that we missed before going to the new stuff?
I mean, just on the compliance piece, there was a report that came out at the end of last year that said only about 20% of hospitals were fully compliant. So there's still work to be done to get everyone on board. We talked about 2019. We said this was sort of a gradual rollout. I would say in 2021, that's when we saw like this major expansion. So yeah, just that the rule has sort of continued to evolve in those three sort of phases, and then we can get to the new stuff. The new update is sort of adding those data requirements that we mentioned at the beginning.
Yeah, so if there's roughly about 5,000 hospitals and 20%, so that's like 1,000 hospitals are compliant with this rule.
Yeah, the numbers are a little bit all over the place. I mean, the one thing is, like, I think the data is just not what we hoped it would be at this point. I think the number of hospitals is a little bit all over the place, but it's just the data still needs to, we still have a ways to go.
I have in my notes for the prep questions that going back to 2019, I have that's when Old Town Road was published, which
I saw that.
Yeah, I don't know, 6 years ago, I guess. At this point,
can we play that?
I don't think we have the rights for that. Back to the new stuff. So the new rule encourages price comparisons. What does literature say so far about patients' price shopping?
I think the research here is pretty interesting. So despite all these efforts to make prices available, very few patients are actually using this information for price shopping. It's not because they don't want to. People think it's important. The issue seems to be that a lot of people don't know how to find the information. There's still some skepticism about whether hospital websites are providing accurate pricing. Other people, of course, are just kind of at the mercy of their insurance networks. So when it comes to price shopping in general, though, people tend to focus on specific types of services. People are more likely to compare prices for services that are planned in advance. Physical therapy it's a great example. It's not urgent. It usually involves a couple different visits, so patients can really benefit from finding a better price if it's available. And I was skimming an article earlier, and it said that even though patients might not be seeking out price transparency data, this segment of what they called price-aware patients is going to grow. So it's kind of in line with other industries like travel. So where consumers' knowledge of the price really transformed the experience, and I kind of thought this was a fun little analogy. You don't have to go with a travel agent that bundles prices together for your family vacation. You can look at hotel, you can look at flight and the rental car and all that. Prices across different competitors. Like you have choices. And I think, that's the same thing we're talking about here.
Yeah, so we see this push, at least from the consumer aspect of trying to have people be more knowledgeable about prices and what that might mean for the experience that they're going to have, whether they enter a care facility or think about entering a care facility if it's something on the elective side. Going back to the rules, these rules create new data points. So from the hospital side or from the provider side, one of these is estimate allowed amount. How might this help patients, and are hospitals going to comply with this immediately?
Well, this is a metric. I can tell you what it is. It's a metric that reflects the average payment that a hospital historically receives from insurers for specific services. It's an algorithm, and I don't think CMS has been too prescriptive about the data that you have to use for this. That's my understanding. It's an algorithm or a percentage that's based on the contract the hospital has with a particular payer for a specific plan. And before this requirement, hospitals could just leave these fields blank or mark them, say not applicable, which wasn't very helpful, as you might imagine, for people trying to make informed decisions like that. So the intent with this is that you're getting a more accurate representation of actual healthcare costs over time compared to just those nominal charges.
So, from what we can tell, or again, someone can correct me if I'm wrong, this started with the first Trump administration, got a little bit more enforcement with the Biden administration. As we look, is it next week? Yeah, next week to the incoming second Trump administration and TikTok going down. What might we be expect from price transparency and the health?
I'll take the first one.
Okay.
I think RIP TikTok. Well, the issues you mentioned, it's had bipartisan support. So I think just the most straightforward answer is I think we'll continue to see legislative focus in this area around price transparency regardless. I think one important question, something that we will want to know is whether average commercial prices for common hospital services have actually dropped since the rules implementation. I think we did an event recently on related to our commercial prices in the healthcare sector. So that's something we'll want to keep an eye on. And yeah, I think it's just easy to get caught up in, we talked a lot today about compliance issues and the data requirements, but it's about more than just posting prices for the sake of posting it. It's about, like, I don't know if we meant, it's really about promoting market competition and choice in healthcare. So that's, of course, a more long-term objective, as so many things in health policy are, Jeff.
Yeah. A very slow moving ship. And if we keep reading Health Affairs, healthcare expenditure and spending reports from CMS over the years, we'll just keep getting a better picture.
We'll get there.
Yeah. Together. Yeah. Well, fantastic. Leslie Erdelack, thanks for joining us again on Health Affairs this week. If you, the listener, enjoyed this episode, please send it to the accountant in your life. Yeah.
The shopaholic.
The shopaholic. Yes. Yeah. Send it to the shopaholic, to those, please send it to your retail therapist and subscribe. Leave a comment in the show notes if you are listening to this on Spotify. It'd just be interesting if people use that feature. And we will see you next week. Thanks.
Thanks, Jeff.